Hi, welcome to our video. Our names are Nikki, Shannon, and Tatiana. Today we'll be discussing the current state of rehabilitation hospitals, which are hospitals devoted to the rehabilitation of patients with various neurological, musculoskeletal, orthopedic, and other medical conditions following stabilization of their acute medical issues.
There are many types of rehabilitation hospitals or facilities. One example is cardiac rehabilitation. Cardiovascular disease continues to be the leading cause of morbidity and mortality in the United States and worldwide. Recently, there has been a drive to move cardiac rehabilitation programs to be in a supervised outpatient setting. Despite this push from the American Heart Association, current statistics show that referral and participation rates of eligible patients are alarmingly low, especially for patients in rural areas and with low socioeconomic status, limited education, advanced age, and/or of the female sex. As we have learned in this course, the use of outpatient care facilities has seen a major push from managed care organizations, or MCOs. This is due to the less overhead costs that they have to pay for compared to someone being treated as an inpatient. In addition to outpatient services being cost-effective, cardiac outpatient rehabilitation programs offer a multidisciplinary, comprehensive approach to address these risk factors and to restore individuals to their optimal psychological, psychosocial, nutritional, and functional status. As a result, morbidity and mortality has been shown to dramatically be reduced by nearly 25% compared to the usual care.
To qualify for Medicare payment, these rehab hospitals must ensure that patients will receive medical supervision from a team of qualified personnel such as PTs, OTs, have a plan of treatment that is reviewed and revised by a physician, and have 75% of patients receiving intensive rehab that lasts 3 hours per day. The quality of rehabilitation hospitals has also steadily improved. The Joint Commission's 3 categories of quality indicators mostly improved among these rehab hospitals. There is positive change in functional and cognitive status after the patient's stay, lower rates of discharge to nursing facilities, and lower rates of readmission. Along with better quality, there is adequate capacity to meet the upcoming demand for services, with an average occupancy rate at inpatient facilities at 65%. The demand is a result of the U.S.'s aging population. Inpatient rehab facilities will only continue to grow in number. Medicare Part A spent over $7.7 billion on inpatient rehab services, and about 350,000 beneficiaries had more than 391,000 days of stay in a rehab hospital. Volume of services rose 2.4% from 2015 to 2016. We discussed earlier that there is future growth in outpatient rehab facilities because of managed care organizations' desire to control costs. But we should also see growth with inpatient facilities. The coverage of inpatient rehabilitative services under Medicare Part A, combined with an expected 79 million enrollees in 2030, will fuel the need for more inpatient rehabilitative services.
The culture of the rehabilitation hospital itself plays a large role in the functioning of the facility. A rehabilitation team consists of many professionals in the medical field, including occupational and physical therapists, medical doctors, speech pathologists, nurses, and many more. The cohesiveness of these professionals is important to the delivery of effective rehabilitative services. A study on the culture of a rehabilitative team within a VA hospital hypothesized that a few important factors in a successful team dynamic were communication, organization, collaboration, and interprofessional relations. A healthy rehab culture will positively affect the outcomes of the hospital. The better the outcomes of the hospital, the better the quality of care, and the less money is spent in readmissions, malpractice, and unnecessary or excessive testing. These outcomes align with the main objectives of a successful healthcare system by delivering services that are cost-effective and meet established standards of quality.
However, there have been concerns of patient harm in rehab facilities in both inpatient or outpatient settings. In a government report published in 2016 by the Inspector General of the U.S. Department of Health and Human Services, 29% of patients suffered from medication error, infection, or some type of harm as a result of the care. Half of these incidents were preventable. A quarter of the harmed patients had to be admitted to an acute care hospital at a cost of $7.7 million for the month that was analyzed. The Inspector General is calling for collaboration between Medicare and the Agency for Healthcare Research and Quality to create a list of adverse events that occur in rehab hospitals. This list would allow providers across all facilities to focus on eliminating these specific issues through greater vigilance, monitoring, and treatment. Of Southwest Florida, there is a nursing home that specializes in rehabilitation that is notorious for causing harm to patients. When I was in high school, I performed my clinical rotations for my CNA license at this facility and experienced it firsthand. Patients would be physically forced to be spoon-fed, sometimes causing harm to the patient's oral cavity. Other patients were neglected for hours on end, resulting in pressure sores, being forced to sit in soiled clothes, and not getting the proper attention to receive optimal rehab. These are just a few of the issues that I have witnessed in inpatient rehabilitation facilities. In my hometown of Southwest Florida, there is a nursing home that specializes in rehabilitation that is notorious for causing harm to patients. When I was in high school, I performed my clinical rotations for my CNA license at this facility and experienced it firsthand. Patients would be physically forced to be spoon-fed, sometimes causing harm to the patient's oral cavity. Other patients were neglected for hours on end, resulting in pressure sores, being forced to sit in soiled clothes, and not getting the proper attention to receive optimal rehab. These are just a few of the issues that I have witnessed in inpatient rehabilitation facilities.
Number 1. What measures can be taken to prevent abuse in rehabilitation facilities, such as in nursing homes? Number 2. Today we discuss inpatient and outpatient rehabilitative facilities. Do you foresee a possible movement of rehabilitative services to be home-based interventions? What possible societal and technological developments or changes in healthcare insurance would favor this shift?